दवाखाना झाला 4 वर्ष बंद.
4 years back, this clinic was constructed.
But it is not yet functional.
The process of community monitoring has effectively changed the mindset of people. People used to think that implementation of health programs is the responsibility of the government alone, and common people hardly have any role. But now, people are realizing their rights. They are now empowered to come together and question the health system for improvement in health services.
If the government had spent 5 lakh rupees on constructing this clinic, then it should benefit us because it is ultimately public money.
So we want working public health facility in our village.
However, it seems the construction department has some technical difficulty in handing over this clinic to us. The concerned engineer should give a letter that construction is completed as per the norms, and then I will immediately take charge of this clinic.
Based on the initiative of villagers from Pimpla Devi village in Beed district, the sub-center which was closed earlier has now started functioning. There are several examples of such change which have been observed during the implementation of this process.
It is responsibility of government to provide free health and education to all.
Now, the villagers are becoming bold. They are realizing their rights and have started speaking about their rights. All this is happening because of the process of community-based monitoring and planning. We should first understand this process and how the process has led to various positive developments.
After the National Rural Health Mission was launched, the issue was raised as to how the effectiveness of this mission is going to be assessed. And the point was raised that while there are internal monitoring systems and there are external surveys which are conducted, these are not sufficient, and there has to be some mechanism to understand as to what are the community's experiences of health services and whether ordinary people are experiencing any improvement in the delivery of these services or not. And therefore, after some amount of discussion, the idea of community-based monitoring of health services as a component of the National Rural Health Mission was proposed, and this was accepted as a component of the mission. And the Advisory Group on Community Action, which is a body formed under the National Rural Health Mission, took responsibility for facilitating the implementation of community-based monitoring across the country on a pilot basis.
In Maharashtra state, Sathi was given the responsibility to work as state nodal NGO to steer and implement the community monitoring process in collaboration with various civil society organizations working with a rights-based approach. The process of community-based monitoring and planning CbMP of health services was initiated at national level in 2007. Maharashtra was one of the 9 states selected for the pilot phase of community monitoring. In the first phase, from 2007 onwards, 5 districts and 225 villages were selected for implementation. In 2009, process was expanded to include additional 450 villages. In 2011, the process was further expanded to 8 new districts. At present, in mid-2014, this process is being implemented across nearly 41 blocks, 140 primary health centers, covering over 850 villages in 13 districts of Maharashtra.
We have all paid tax to the government. Hence, it is our right to question the government. The main objective of this process is to create an enabling environment so that even the ordinary people can ask such questions to the health official.
Through the process of community-based monitoring and planning, various attempts have been made to ensure community participation for resolving issues related to health services at PSC, block and district levels.
Various activities like Village Health Day, Health Awareness Campaign, Street Plays, Prabhat Feri were undertaken to ensure awareness of health rights. Awareness material like posters on health rights, booklets, poster exhibitions was developed. Villagers and health workers joined together and have organized health awareness days. Now, ordinary people have got an idea about the role of health workers and also their problems. Implementation of community monitoring of health services was not limited to the community level. Rather, proactive monitoring and planning committees have been formed from village to state level with the involvement of various stakeholders. Based on activities carried out from village to state level, like frequent dialogue and follow-ups, regular correspondence with health officials, training of volunteers, village meetings, and so on, ordinary people are now empowered to monitor a technical area like health services.
CbMच्या कामामधून गावामध्ये कमिट्या झाल्या.
Various multi-stakeholder monitoring and planning committees such as village health committees, PSC monitoring committees, block and district level monitoring committees as well as state level monitoring committees have been formed through the CbMP process. With the participation of villagers, committee members are monitoring health services and the overall functioning of the health facilities. Members of the monitoring committee now ensure that children are weighed in the presence of villagers. They make visit to Anganwadi and health facilities and check registers also. Villagers are genuinely taking the interest in improving the Anganwadi and health facilities. So the workers also give their best to improve its functioning.
हे आमचं तेलखडी गाव आहे आरोग्य केंद्र.
This is our village Telkhadi. Construction of new primary health center is going on here. As a member of the monitoring and planning committee of Telkhadi, we monitor all these aspects of construction.
If ordinary villagers are to evaluate health services, then simple yet objective methods must be developed. We are familiar with the report cards given to school children. Based on the same format, a pictorial report card has been prepared for monitoring health services. These report cards are filled based on group discussions and meetings organized in various parts of the village, including settlements of marginalized sections and outlying hamlets.
I don't know. Is there availability of medicine stock? Paracetamol is not available, so we have given you 0 marks.
प्राथमिक आरोग्य केंद्राची प्रश्न.
This is the pictorial tool for PSC. We fill this on annual basis. All the committee members come together and fill this PSC tool. The health report card reveals the situation of health services in the village. Good is colored as green, partly satisfactory as yellow, and bad situation of health services is colored as red.
Issues that have been identified in the report card are reviewed in the monitoring and planning committee meetings. As far as possible, committee members try to resolve such issues at their level.
During the CbMP process, along with monitoring the functioning of the PSC, we also attempt to resolve various problems faced by PSC staff. We present their problems in block, district and state level public hearings as well.
Public hearing or Jan Sunwai is a kind of public forum to solve issues and ensure justice. In the process of CbMP, more than 450 Jan Sunwais have been conducted until March 2014. Information is collected before the assigned date of the hearing. People present their problems in the public hearing on the basis of such concrete information. Government health officials and staff have to give answers regarding the issues raised in the hearing. Solutions related to these issues are often clinched and timeframes for corrective action are decided upon in the hearing itself.
Public hearings are very important and appealing to people because rather than writing applications and doing tedious follow-up, in a public hearing you get an immediate response from officials about the issues raised by you.
The post of medical superintendent here is vacant since last 10 years. Sonography services are not available. Medicines are also not available in adequate quantity.
We have noted down all the points presented by you. Basically, this community monitoring process is helpful for us to improve health services.
Local elected representatives are also becoming active participants of the monitoring committees. They are now insisting that the health system should function in a more accountable and effective manner. Implementation of community monitoring has helped considerably to improve the quality of health services and has generated a sense of accountability in the health system.
Earlier, donation box kept on the doctor table. The PSC monitoring and planning committee members came to know about the strategy of the doctor to charge money illegally from patients. The committee has now converted this donation box into a complaint box.
Community monitoring has helped health personnel to connect to far-flung villages and has also renewed the faith of ordinary villagers in public health system, encouraging them to access healthcare. Monitoring by the community is helping to control corruption and has led to change in behavior of the health staff, making them less rude and more responsive in many places. When people come together, effective change begins to happen. The process of community-based monitoring is living proof of this principle.
Previously, we were not aware about the immunization services at the PSC. But now, villagers question the PSC staff if immunization is not conducted on the said date.
As a result of formation of the PSC Monitoring and Planning Committee, now doctors have started coming to the health center on time.
The Monitoring and Planning Committee plays an important role in bringing together villagers, PSC staff and medical officers to improve services.
Earlier, facilities were observed to be apathetic and unresponsive, but now, due to CBM, the medical officers are working quite actively. This has helped in renewing the faith of ordinary villagers in the PSC.
The community monitoring process is contributing to making the health system and health officials more responsive.
We have to put pressure on the public system through people's mobilization and participation.
People's awareness about their rights and responsibilities would definitely lead to everyone demanding improved services.
CbMP has developed as a people's movement. This process is really transparent and helpful.
Now the doctor and ANM have started coming to the PSC regularly.
The behavior of the PSC staff has now improved a lot.
We used to feel afraid while visiting the health center. Now we have become bold.
CbMP has contributed in developing feeling of ownership in the people towards the public health system.